Greetings of the day. So today we are going to discuss about intellectual disability, and I'm Adira Das, and I am assistant professor in the Department of Psychology. So shall we start the topic? So intellectual disability is being called as mental retardation in the previous period of time, and it is formerly known as it is formally known as mental retardation. It's quite easy for you to connect with the concept. It's a neurodevelopmental disorder that has been characterized by significant limitations in the intellectual functioning and adaptive behavior of an individual. Intellectual functioning includes the major complex intellectual functioning like decision making, problem solving, rational thinking, while the adaptive behavior include the basic life skills. An intellectual disability is when limitations in your mental abilities affect your intelligence, learning, and everyday life skills. And these limitations must be present during the developmental period. Some people with average or high IQs can still be having trouble with life skills, while others with lower IQs might have strong enough skills in other areas they that they don't meet the full criteria for intellectual disability. So, to be diagnosed with intellectual disability, an individual must meet the criteria as outlined by DSM-5-TR, which is the recent form of like material, or the DSM-5-TR is the recent technique or material that we check to figure out the major criteria or major requirements to identify a particular disorder. It has been developed by American Psychiatric Association, and some of the major criteria for identifying intellectual disability are deficits in intellectual functioning that include impairment in reasoning, problem solving, planning, abstract thinking, judgment, academic learning, and learning from experience. These deficits are confirmed by a combination of clinical evaluation and individualized or standardized intelligence tests. An IQ score of approximately 70 or below is considered as a key indicator of intellectual disability. Second criteria is deficits in adaptive functioning, which are the failures to meet developmental and socio-cultural standards for personal independence and social responsibility. These deficits limit functioning in one or more activities of daily life, such as communication, social participation, and independent living. Adaptive functioning is assessed in three areas: conceptual domain, social domain, and practical domain. Conceptual domain skills related to language, reading, writing, and math comes under conceptual domain, while social awareness, communication, friends creation, interpersonal relationship include social domain. Practical domain include personal care, job responsibilities, money management, and lot more. The third criteria is onset during the developmental period. The deficits in both intellectual and adaptive functioning must be evident during childhood or adolescence. The severity levels are having some specialities, or severity levels are now associated more with adaptive functioning than the IQ score alone. This is a shift from previous editions, which relied more heavily on IQ. Now, currently, we have four severity levels: mild, moderate, severe, and profound, which describe the level of support the individual might require. So, mild, they have an IQ range of 50 to 70. They learn academic skill up to the sixth grade. They have struggles with abstract thinking and managing money, and they can have issues with forming relationship, to understand the social cues, to live independently as well. While the moderate level include will be able to learn basic academic skills, can form relationship in a limited manner, and can perform self-care but need constant support from others, which have a 35 to 50 IQ range. Severe has limited conceptual skills. They can't understand the simple language or gestures. Like still they can understand it, but it's very limited for them to communicate. They need intense, extensive daily support and supervision. Their IQ might be from 20 to 30. Profound, they have very limited conceptual understanding. They expresses desires and emotions through non-verbal cues and request continuous monitoring 24 by 7. High level of support is needed below 20. Probably they might be bedridden. Some of the causes of intellectual disability are prenatal causes that include genetical or chromosomal conditions, chromosomal abnormalities, single gene disorders, and maternal infections and illnesses, which include rubella and Zika virus, exposure to teratogens like alcohol, which leads to fetal alcohol syndrome, FASD, and other drugs like lead and mercury. Perinatal causes include the issues that happen during delivery and labor, which are perinatal asphyxia, extreme prematurity, or birth traumas. Postnatal causes include infection, traumatic brain injury, environmental factors like malnutrition or severe environmental deprivation, exposure to toxins. So, neurodevelopmental conditions associated or comorbid with intellectual disability are ASD, epilepsy, CP, and learning disorders. So their assessments, many assessments are done in order to understand the levels of individuals, which includes significant deficits in intellectual function, can be assessed through individually administered standardized intelligence tests like Wechsler, Weiss, and WISC. And significant deficits in adaptive behavior can be identified through techniques or scales of adaptive skills, which are adaptive skills, while the additional assessment can be done through developmental history, medical and genetic testing, and assessment of occurring conditions. The treatment, usually it's a comprehensive treatment that we utilize. It include educational and occupational supports, individualized education programs, function skills training, and vocational training, while therapeutic interventions can be developed using a combined approach, which includes speech and language pathology like therapy, occupational therapy, physical therapy, and social skill training. Behavioral psychological treatment include ABA, apply behavioral analysis, behavioral support plans, modified circuit therapy, and the successful management of intellectual disability is a lifelong and collaborative effort, and that shift from early intervention and special education to vocational training and supportive community living. So it's a comprehensive approach that we are going through. So uh, in this whole class, we discussed about intellectual disability, the various symptoms associated with it, criteria related to it, causal patterns, and treatment plans. So that's it for the day. Thank you.